cancer, I treat people. And so I really, in the approach to patients, I try to see them as a whole person. So often with cancer patients, when they're going through the conventional model, it's all about cancer. It's cancer, cancer, cancer. So the first thing I do is try to get them to take a step back and see, you are a whole person. I'm treating you. You just happen to have cancer. In terms of legally, can we treat cancer? That varies by state. In some states, it doesn't matter if they have an oncologist on board or not. In some states, the patient has to have an oncologist on their team as well, or they have to have at least seen an oncologist. In some states, we don't have the jurisdiction to use the word treat, and so we just help people find balance in their health. So legally, that, can we treat cancer changes by state, but more philosophically, again, I treat people, I don't treat cancer. I just like the population I work with are patients who have cancer. Yeah, so there's a ton that we can do for side effect management. Most generally with everybody, I'm talking about nutrition. I'm talking about hydrotherapy, which is the use of water, hot and cold water as a therapy. I'm talking about using supplements. And so all of these things help their whole health and also help reduce side effects. There are specific things, let's say for nausea, which is a very common chemotherapy side effect. So there's some specific things that can help, like ginger, and different essential oils and some acupressure points as well. So we're working on that. And then also too, just, a lot of different side effects come up, GI complaints, neuropathy is really big with cancer as well, or with chemotherapy as well. And so there's different supplement protocols that help. But again, addressing nutrition and reducing overall inflammation in the body by addressing that, and with hydrotherapy, can also help reduce side effect profiles as well. I do also like to use some I call them higher level interventions. And that's because they do involve injections. So some IV therapy and also mistletoe therapy, which is a subcutaneous injection. The mistletoe therapy specifically has a ton of research to support it reducing side effect profiles alongside conventional therapy. So there's a lot that we can do. And I find my patients do very much tolerate conventional therapy. At least I feel a little bit better, that at least, or a lot of it better, varies by person, than people who aren't using holistic medicine in conjunction. Oh yes, definitely. And acupuncture, I don't personally do acupuncture, but I refer for it all the time. There's so much. I like to say, it's, when you go to the conventional doctor for cancer, they have a small toolbox to help. They have like, chemo and radiation and surgery, and I have Home Depot. So, I have all these different tools, and I forget about to mention, there's so many. But also in that, it's very individualized in, in what the person's experiencing. But even in terms of herbs, someone may resonate with one herb and not another. And so I pick and choose based on that. Definitely. And it brings up a larger question of, can you do this without conventional therapy at all? And I say that it's definitely a possibility. I think it's an individual decision though. And it's based on where they're at in their process, what options are available, the individual cancer type. I would never, and I never push people in one direction or another, unless I really feel like it's warranted. But even then, I really try to give my patients as much information as possible, whether it be about conventional therapy or about the natural things that we're going to do, and let them make the decision that resonates with them. Because ultimately, at the end of the day, it's their body. And so they have to be the one who's comfortable with the decision. But yes, I do have some patients who don't want to do conventional therapy, and I work with them and we've had success.